Welcome to the 5 Steps of Evidence-Based Practice. Many BOC-approved providers and athletic trainers are asking, what is evidence-based practice? The answer is simple. EBP is the combination of clinician expertise, patient values, and current research evidence to drive the decision-making process for patient care. One of its most important purposes is to improve patient outcomes. The EBP model seen here is a classic illustration which outlines the integration of the 3 distinct parts. As a whole, the premise of EBP is to enhance reasoning and decision-making in clinical practice, which ultimately can improve the outcomes and cost-effectiveness of patient care. This concept of EBP is not new. It dates back to the mid-19th century. Many other professions have integrated the use of EBP into their clinical practice, and over the past decade, several accrediting bodies and governing agencies and healthcare payers have emphasized the need for EBP in healthcare. One of the difficulties about adopting the EBP process throughout daily clinical practice, or using it to develop continuing education programs, is the lack of knowledge and awareness about how it should be conducted. It is critical for healthcare professionals to remain current with available evidence. The evidence can be synthesized and shared with clinicians through continuing education programs developed by BOC-approved providers. Thus, understanding the EBP process is an essential step for creating EBP continuing education programs and the potential for the greatest patient outcomes possible. EBP programs do not simply mean the program has references, but rather the principles of EBP are used to develop the education program. EBP programs are created using 5 steps. First, ask a searchable clinical question. Second, find the best available evidence to answer the question. Third, appraise the evidence. Fourth, apply the evidence with clinical expertise, taking the patient's wants and needs into consideration. And finally, evaluate the effectiveness and efficiency of the process. The first step, and for some, the hardest step of the EBP process, is to develop a sound clinical question. Clinical questions should be narrowly tailored and focused on the patient. Broad and general background questions are not appropriate for EBP continuing education programs. Questions that focus on the clinician are not compliant for EBP programs either. The most important aspect of finding the right answer is starting with the right question. Question writing is a skill that takes time and practice. As you work towards formulating a clinical question, consider what the end product you want to achieve is and what it is that you want to know. This should match your needs analysis or knowledge competency or performance gap for your education program. Providers often find it easier to create an EBP program from the ground up rather than trying to develop a clinical question that fits a predetermined answer or a program that is already developed. Often, developing programs backwards is difficult and feels awkward even to the most advanced clinicians, researchers, and education providers. Developing a sound clinical question is the most important catalyst, yet often the most overlooked step of the EBP process. A well-built clinical question should direct an answer that is focused on the patient-centered outcomes and will not only improve the quality of care, but will also increase patient satisfaction with the care they receive. Conversely, a poorly written clinical question can result in one of 2 situations. Either the clinical question is not clear enough, which produces irrelevant literature during the searching process, or the clinical question is so broad that the result is an excessive amount of information obtained by the search that may be unmanageable in a given period of time. These are background questions. Typically, a well-constructed clinical question identifies specific components. These elements are often referred to as PICO, which identifies first the population or patient problem, second the intervention or area of interest, which may include specific diagnostic test, treatment, therapy, or medication, third the comparison intervention or group, and finally the outcomes. You may also hear these elements referred to as PIO or PICO with a T. In some cases, a comparison intervention or group may not be applicable, so the C becomes irrelevant. In other instances, a well-built clinical question may include a fifth element of time, such as 2 weeks, the acute phase of care, 6 months, etc. Clinical questions may also be grouped into several categories such as diagnosis, therapy, prognosis, harm, or prevention, which allows the clinician or program developer to further individualize their search for the best available evidence. For more information on developing clinical questions, please see our video, Developing Clinical Questions. The second step of the EBP process is to search for the best available evidence. Once a clinical question has been clearly defined, the clinician or program developer can utilize the question to determine which databases are most suitable to search and which specific keywords will be most influential in obtaining accurate and useful information. Although developing the clinical question may be the most crucial of the 5 steps of EBP, searching for accurate literature and narrowing it down to a manageable amount of information is by far the most time-intensive. Therefore, knowing how to search through numerous sources and minimize information to answer a clinical question is crucial. While access to various available databases will differ between individuals depending on which resources are available to them, here are 4 sources for finding evidence. Each of the resources have their own benefits and limitations. Go to each website and review the resource. Use these databases to find literature and answer your clinical question. The third step of EBP involves critically appraising the evidence. Unfortunately, publication does not necessarily ensure the quality of a study. Therefore, critically appraising the evidence may be the most difficult step for clinicians or providers new to EBP because they are unfamiliar with the methods used to evaluate and appraise research literature. The purpose of critically appraising research evidence is to determine whether the results can be translated and applied during clinical practice. Essentially, the clinician or provider should be able to answer 3 general questions for each study that is analyzed. First, what are the results of the study and are they reliable? Can they be reproduced if the same study was conducted again? Second, are the results of the study valid? More specifically, did the results produce answers to what the clinical researcher was initially looking for? And finally, what are the findings of the study clinically relevant to the particular clinical question? It is important for a clinician or provider to be able to identify the positive aspects of a study as well as the negative ones. As is in human nature, no single research study is perfect. Therefore, being able to identify flaws, limitations, and threats to validity will not only necessarily eliminate the study from consideration, but will aid the clinician in making a thorough clinical decision. The fourth step of the EBP process entails applying the best available evidence. It is important to note that this step does not just include incorporating the best research literature the clinician or program developer found to answer the clinical question. To successfully complete this step, it is important for the clinician to consider their own expertise or experience regarding the particular clinical question or problem, as well as include the patient in the decision-making process so that their values, goals, and preferences regarding the treatment will be considered. As we mentioned previously, the EBP process is not a cookbook approach to practice, so the clinician should not be forced to provide a certain treatment or act in a particular way they are uncomfortable with. During program development, be sure to include evidence to refute a certain intervention or treatment that you are investigating when available. An EBP program should not push a participant to provide a treatment or intervention to promote a particular position or agenda. The program should be all-encompassing and reflect the evidence. In some cases, best practice or clinical recommendation may not be established. In the event that further research is needed, this too should be shared during an education program. The final step of the EBP process involves evaluating the outcomes of a particular patient case or population. More specifically, did the PICO formulated clinical question, literature search, thorough critical appraisal, and application of the best available evidence achieve appropriate outcomes and benefit the patient, the clinician, and the setting in which it was being utilized? As with any aspect of patient care, it is important for the clinician to take time to reflect on past and current patient cases to help them to continue to make informed patient care decisions in the future. Now that you've completed the 5-step EBP process, you're ready to develop a continuing education program and share your knowledge and outcomes with athletic trainers. Additional resources can be found on the BOC website to help develop education programs. Unfortunately, through time, several misconceptions of EBP have developed. One of the most common misconceptions is that EBP is a blueprint on how to practice within healthcare professions and discounts the need for individual clinical judgment. More specifically, some healthcare providers believe that EBP creates a cookbook approach to clinical practice and will therefore produce cookbook clinicians. However, what it is important to recognize here is that evidence-based practice is not a set of robotic guidelines, but instead an integration of 3 fundamental elements to enhance the clinical decision-making process. As we mentioned earlier, evidence-based practice not only uses the best available research evidence, but also incorporates the clinician's individual expertise as well as the patient's own personal values, goals, and preferences. Evidence-based practice is about practitioners combining their experience with other sources of evidence in order to make decisions which they hope will bring about better outcomes for their patients. This does not mean that research evidence of, quote, what works will automatically override the clinician's experience, although that expertise needs to be both reliable and valid. In other words, clinicians need to be aware of their own limitations and their experience in the decision-making process, particularly if that experience is not relevant to the task at hand. To truly capture the premise of EBP, it is essential that all 3 elements are included throughout patient care. In addition to the cookbook misconception, EBP has also become a catchphrase for anything within clinical practice that can somehow be linked to an experimental study, regardless of the quality of the evidence depicted in the study. Again, it is important to remember here that the evidence-based practice process should include consideration of both positive as well as disconfirming evidence. By identifying and weighing both sides of the available evidence, and of course factoring in the clinician's own experience as well as the patient's goals, clinicians can make stronger clinical decisions as well as be able to more accurately discuss the benefits and caveat of such choices with their patients. Third, some individuals believe that to participate in evidence-based practice means to conduct research. Evidence-based practice is not about attempting to create new and generalizable knowledge through the conduct of research, but rather EBP is about making decisions using the best available current evidence in order to improve patient outcomes. That does not mean that clinicians do not engage in some form of inquiry or evaluation of their impact on patient outcomes, but the emphasis is on both the improvement of the clinician's capacity and capability and better patient outcomes. In other words, EBP is here to help clinicians improve rather than prove. This concludes the 5 steps of evidence-based practice. Thank you to Dr. Kaylee Bacon for providing some of the content for this presentation. To answer more of your questions, check out our other videos.